Hello people, this is Dr. Madhushri and today I'll discuss about the Indian drugs related to cough. This is episode 1 where we will be discussing about Blatta Orientalis, which is also known as Indian cockroach, Arshula or Talapo. Now this will be a very long series where only one drug will be discussed in each video. Indian drugs should always be given prime importance not only because they are easily available, but also they are highly efficacious for a wide range of diseases that commonly occur in India. So let us get started. To begin with, the accidental proving, which is mentioned in Clark. Once upon a time, tea was being prepared for the guests. And guess what? Accidentally, a cockroach fell inside the teapot, and along with the tea leaves, now that cockroach was also a part of the infusion, and that tea was served to a patient who was suffering from chronic asthma. Miraculously, the patient was completely cured of it. And now emerged the most expected question that what was so special about the tea? What special herbs or ingredients were used? When all the medications failed, one single cup of tea was a boon. So what was so special in that? And then a wonder came to light. A cockroach, can you even bear that sight? So this way, Blatta came into existence and became a part of our materia medica. But presently, this medicine is prepared by the process of trituration of the live insect with milk sugar. Now let us see the symptoms. The first prover of this medicine was Pandit Ishwar Chandra Vidyasagar. It's a very good medicine for asthma. In fact, it's an excellent remedy for asthma, and along with that, it's effective for bronchitis, cough, and especially for dyspnea. So, as you can see in the picture, it's a scene of suffocation. So, this patient have a great accumulation of mucus due to which there is suffocation. Suffocation was actually threatened by great accumulation of mucus. There is much shortness of breath for that reason. Cough with dyspnea in case of bronchitis as well as tuberculosis. So much mucus accumulates actually due to which the person feels suffocated. In case of acute diseases, in acute cases, you can use lower potencies which will be better, whereas in chronic cases, it's better to go with a higher potencies. Choice of potency should be mother tincture of course, 3x and 6x are also effective. The patient gets aggravated in the rainy season. Please remember this is a very important modality for Blatta that there is aggravation in the rainy season. Now we have to compare a few other medicines which are having similar kind of suffocation. And of course, first in the list we will have arsenicum album. So arsenicum is a very similar medicine for suffocation. Symptoms are more or less similar, and in fact it is also said that Blatta is indicated after arsenicum when it is insufficient. That means when once you have prescribed arsenicum album, the symptoms are not being relieved. At that time, Blatta can be helpful. So, along with suffocation, arsenicum never fails to show that anxiety, that fear of death, that restlessness, and of course that exhaustion and lethargy. So, in case of arsenicum album, there is similar kind of suffocation like we have seen in Blatta, but there is anxiety, there is fear of death, there is mental restlessness, and there is exhaustion or lethargy. Now let us see the other medicine, that is Hydrostis canadensis. Similar kind of suffocation is there in hydrostis as well, but it's mainly when lying on the left side. In case of hydrostis, there is suffocation mainly when lying on the left side. There is emptiness in stomach, there is emaciation, and there is loss of appetite. So as we can see the triads in arsenicum album, along with suffocation, we have anxiety, fear of death, exhaustion, and this restlessness. Whereas in case of hydrostis, we have emptiness in the stomach, emaciation, loss of appetite, and the suffocation is mainly when the patient lies on the left side. And the next medicine that we have is Calisal. There is rattling of mucus in the chest. There is so much mucus accumulated in this case, or there is so much of suffocation that there is rattling of mucus in the chest. post-influenza cough, especially in case of children. So calisulf is most often called the post-influenza cough, especially in children. So the cough is worse in the evening and in hot atmosphere. Please remember that. In case of calisulf, aggravation is there in the evening and in the hot atmosphere, whereas in case of Blatta, we have seen that aggravation was there in the rainy season. So we are in the end of this episode. Thank you so much for listening. Like, share and subscribe if you like my videos. Thank you so much.